It's health and wellness time. And in the previous video, I stated that we were going to discuss the 6 misconceptions that prevent men from being screened for prostate cancer. Now, number 1, fear of examination or fear of the examination process in itself. Many of you fellas are just uncomfortable with the idea of having the digital rectum exam, where your professional or your doctor, your practitioner, your nurse, your urologist will put on a glove that is lubricated for one finger, and they'll insert that into your rectum. Or you may need to receive a blood test known as a PSA. But my question to you is why? Why would you try to skip this method of examination for prevention altogether? Like, why would you do that? And then my next question is, would you skip the examination method because of discomfort, or would you skip it due to embarrassment? 2, or is it that you believe that prostate cancer can only affect older men? While prostate cancer is more common in older men, it can still occur in younger age groups as well. Therefore, you thinking that prostate cancer really should be like for older people, when it should not be dismissed by any male at all. 3, lack of or no symptoms at all in early stages of prostate cancer. That means that you may not have any symptoms at all, any symptoms that are noticeable. And then some guys may just mistakenly believe that they feel fine and they don't need to be screened at all. Is this you? 4, you're in fear of being diagnosed with cancer. Many of you men, or many of you guys, just downright avoid being screened due to being afraid of receiving a cancer diagnosis. You just may prefer, I don't know, you may prefer just not to know about the potential health issue rather than just facing the music and dealing with it head on. And when I say that you'd rather just not face the music, I mean you dealing with it emotionally, or the physical challenges that may be associated with any type of cancer treatment. Number 5, misinformation. Misinformation, or the misconception about treatment options. Because I think that's huge here. Some men may have heard negative stories about prostate cancer treatments, or I can give you some examples, like whether it comes to the surgery or the radiation or the therapy, which led them to avoid the screening out of plain old fear that they potentially may have some type of side effect or complication. Number 6, cultural or societal stigmas. In some communities, discussing health issues, particularly those related to sensitive areas like the prostate, may be considered taboo. This can definitely be a reason of why men can be discouraged from seeking medical attention or discussing their concerns with healthcare providers, family, friends, significant others. But fear not, my healthy tea followers, fear not. There are ways to keep this special room in the best of shape. Regular checkups, screenings with your healthcare providers. Now, fellas, I want you to realize that it's just like you keeping regular maintenance on your house. If you're keeping regular maintenance on your house, which is like your body, then I'm going to need you to go out, reach out to a healthcare provider today or yesterday, actually, that can catch these issues early. Reach out, get screened. It doesn't take long to set up a routine history and physical, which in turn will keep your prostate running smoothly. So, in conclusion, one should address any misconceptions or fears through education, open communication, and awareness. Being aware. I talk about it all the time here. You guys should be used to it by now. Miss T's definitely going to tell you at all times to be aware. Awareness. I want you to campaign awareness to help with encouragement for other men. Maybe, just maybe, this will help another man prioritize prostate cancer screening and be proactive in taking steps towards maintaining their health and overall well-being. Now remember, the prostate is small, but it packs a mighty punch. Check back for part 3 of the prostate series tomorrow, where we will discuss the consequences of delaying or avoiding prostate cancer screening. This has been your Healthy Tea segment. I'm Miss T. Toodles.